Hey, how's it going, Kelsey?
It's going great.
Great. My name's Tyson. I'm a student physical therapist here working under Dr. Purcell.
Okay.
Yeah, and so I'll be seeing your treatment today, and I work side by side with him, but this is part of my schooling.
Oh, okay, cool.
Yeah, and I'm excited about it. I'm getting into it, and I love it. Just know that he's going to be making sure I do everything okay.
Okay.
Okay. But for this examination, we're just going to go over your condition and things about it and what's going on, okay?
Okay.
Great.
Great.
Great. I have your screening form here, so I'm going to be referring to this, and I might ask you some repeat questions. Most of the time it's because I either want to make sure it's right or I want to clarify something, okay?
Okay.
So don't think this was for nothing. This helps me a lot to know exactly what I'm going to be doing. This is just this is a good reference, and then I can get a little more detail, so we can get the best treatment for you. Okay?
Sounds great.
Great. So let's get into it. Let's see. So we're seeing you for your wrists. Is that right?
Yeah.
Okay. And it says you're having some weakness, aching, pulsing in there. Is that right?
That's right. It's bothering me a lot.
Okay. Just letting you know, I'll probably be typing on my laptop as well. And that's the same reason I just want to give you as good of care as I possibly can.
Oh, well, I love that.
Yeah. So I'm going to make sure that I get all the details, and I promise I'm listening. I just want to, I see so many patients, 12 patients a day,
That's a
so
lot.
it's easy to forget. Anyways, so you have that pain in your wrist. How long have you been feeling that for?
Let's see, I've been feeling that for a long time, probably years, but it's just recently come on because I've been exercising a lot more. It's probably in the last couple weeks I've started some like weight training. So especially when I'm lifting weights, it just causes a lot of pain through here,
Okay.
and just it feels like I can't hold it up, you know.
Yeah, so you feel like you're limited in your workouts.
Yeah, that's exactly it.
That's annoying.
It is.
I've had things similar to that where like some part of my body is limiting me, and it's kind of frustrating because you feel like you can do more.
Yeah.
Okay. Well, I'm sorry about that. So, with that, you're getting the pain in your wrist. Is that the thing that's bothering you the most? The weakness or the pain?
That's actually, I think probably overall, like the weakness is what stands out the most. Like pain is probably, it's really not that high. But when I'm lifting weights like over to a bench or something, like I feel like my wrist is just gonna fall off. Like it just feels like so much strain on it. Like my wrist just can't take it.
Okay. So it's
And
mostly the
like
weakness.
yeah, and like after a few after lifting for a little bit, my grip strength is just gone. Like I can't hold on to things.
Okay. When you rate your pain from a scale of 0 to 10, 10 being the worst, 0 being nothing, 10 being like the worst pain you've ever felt or could ever feel, how would you rate your pain? I know it's mostly weakness, but also how do you rate the pain?
Just a 5.
Okay. 5 out of 10. You got the wrist weakness. Okay. That's good to know. So that we're gonna go into a lot more details with that. I want to get an overview of everything else. See if there's anything else that might be playing a role in that, but also we just want to make sure there's not something else we can treat.
Okay.
So let's go through this. So you have past surgeries, tonsils out, wisdom teeth. You're not having any complications with that, right?
No.
I wouldn't think so. Usually there's not. Just want to make sure. And you're not taking any medications for this condition.
No.
Right?
No.
Are you taking any medications at all?
Yeah, I'm taking like omeprazole for acid.
Okay. Yeah, that's. And anything else?
No, allergy medication.
Oh, allergy medication.
Yeah,
Okay.
seasonal.
Only reason I ask is, I mean, there may be some medication that has some indications of like what kind of exercise you should be doing or what we should avoid. I think those are okay. We're just to make sure we have our bases covered.
Okay.
Let's see. Everything looks good here. In your family history, It looks like you have some history of cancer, diabetes, high blood pressure, some osteoporosis and arthritis. Okay. And do you know if you have had any of these conditions here? Okay. That's good to know though. Could be some things lead into there. So got those in there. Get that in the chart. Looks like things are going really well. Have you gotten any imaging done, like MRIs or X-rays for your wrist? No imaging. What about your life? Like, are you working right now, or are you?
So I'm
a student?
actually a physical therapy student.
Oh,
so-
great! Hey, so you're gonna be like me
Yeah.
soon. Okay, great. And I guess that's why you felt comfortable coming to a physical therapist.
Yeah.
Great.
Physical therapy.
Have you had physical therapy before?
I actually haven't. No.
Okay. Well, I'm sure. Well, if you're a student, then you've shadowed, so you have a good idea what it's going to be like. I'm sure it's going to be pretty similar to what you've experienced. I feel like here at our clinic, we take extra good care of our patients. So maybe you'll see it's a little bit better clinic than you're used to. I don't know. We'll see. Okay, well, that's good to know. So, as a student, you're sitting a lot. I know that. There's some labs where you're standing and things. Has your schooling or anything of your life been impacted by this condition?
I mean, the only thing I can think of is occasionally, like after I've been doing some weightlifting, like it's hard to write notes for a long
Okay.
time. My hand just starts to cramp up, and I have to roll it out. I have to shake it out, and that's really the only thing.
What's your living situation like? Do you live on your own, or are you living with roommates?
I live with my husband.
Oh, great. Awesome. And is that where is that, in a house, an apartment?
Apartment.
Great. And is there anything at your home that's affected by your condition at all?
No.
Okay. No effect in home life. And is your husband it doesn't seem like you'll have anything where you'll need a lot of help, but is your husband able to support you if you need help with exercises or anything like that?
Yeah.
That's good to know. All right. And tell me about your activity level. Like, it says here that you do exercise a couple times a week. Is it 2 to 3 times a week that you're exercising, or?
Sometimes 4 or 5.
And
on
what?
a good week.
Oh, great. And what does that exercise look like for you? Is it lifting weights or?
Lots
Cardio.
of lifting weights lately, but I'll do cardio every now and then.
Okay, mostly lifting weights, but some cardio. And I do know the weightlifting because you said that it's hard to be doing those weightlifting. Some of the moves because your wrists just feel like you can't hold them. Okay. Exactly. Great. Well, I just wanted to, I guess not great, but that's good to know. It helps me to plan your care. Sorry about that.
That's okay.
I wanted to go over just your general overall health, your lifestyle habits, things just about your general health to make sure there's no other conditions.
Okay.
Yeah. So it looks like on here you said you don't drink or smoke. Is that right?
Yep.
Right. And then tell me if you, and I think you checked no on all of these. I just want to make sure. So no unexplained weight loss, fever, chills, nausea, vomiting, dizziness, lightheadedness.
No.
Great. Falls, undue fatigue, weakness, numbness, tingling, and any cognitive changes, like loss of memory or anything like that.
No.
Okay. It seems like you're in really good health other than your wrists. To me, no trouble sleeping. It looks like the 3 things that are affecting you most, or where you're feeling the pain the most, is weightlifting, plank hold, grip strength. Okay. What about your heart, and your lungs? Do you have any conditions, or have you noticed any difficulty breathing, or your heart racing, anything like that? Great. Well, the last thing I want to do with you is I want to write some goals down. I just want to make sure we're on the same page, and I want to cater your treatment to exactly what you want.
Okay. Yeah.
So what would you say are a couple of goals that you want to achieve during our therapy?
Well, probably probably I just I want to be able to lift weights without feeling limited by my wrists. So just wrist strength. Be able to hold a plank. I just can't even hold it as long as I could because my wrists hurt. Yeah, and just not have pain afterwards.
So no pain after holding a plank or lifting weights, and also not being limited.
Yeah.
In your weightlifting by your wrist. Okay, that's good. Let me just make sure I got everything right.
Okay.
Don't want to have anything wrong here. I don't want to mess up your treatment. So, we're coming in for wrist pain. You have weakness and pain. Weakness is probably the thing that bothers you more, but pain as well. 5 out of 10. Omeprazole, allergy medications, what you're taking. No lab imaging. You have some family history of some illnesses, but none of them that you're experiencing that you know of. Some things about your lifestyle that's affecting is writing notes. You're living a pretty healthy lifestyle, exercising most days of the week, so that's good to know. And your general overall health seems to be good. Is there anything I missed there? Or last thing was just the goals of being able to lift weights without limitation from your wrist. No pain in a plank or weightlifting. Okay. It seems like we've got it all set up. So I'm going to use this information to make a plan, and we'll go from there. Okay?
Sounds great.
It was great to meet you. I'll talk to you another time, okay?